Picking up here, the CRL Rights Commission has called for more collaboration between cultural and religious communities to help fight the COVID-19 pandemic. We can speak to Professor David Mosoma. He's CRL Commissioner and joining us now live. Prof, a very good afternoon to you. Grateful for your time. Let me begin first with your assessment of the level of compliance from the religious communities with the lockdown.
Thank you so much to you and your viewers. The level of compliance is very good. In fact, I want to applaud and commend many of the religious leaders, religious communities and cultural communities who are really doing their best under these very difficult circumstances to comply. But we call for more collaboration, because the only way in which we can defeat the scourge of this Delta virus is for us really to pull ourselves or to pull our ranks together, because this particular pandemic requires that we change our conventional way of living and adopt a new normal, so to speak, business unusual. Because unless we do that, as we have already called in our statement, we will actually perish together as if we're all fools.
I don't know if you've seen this, Prof. We on Newsroom Africa carried a report and a briefing from Friday where a group of religious leaders, church leaders, were saying that they actually feel hard done by the lockdown and in fact want to resume services. I remember one of the pastors saying that no one has been able to say that a cluster outbreak of COVID-19 infections has been traced back to a particular church. Therefore, it makes no sense to close the churches during this 2 weeks. How do you respond to that?
Well, we are not scientists in the first place. Let's leave the issue of science to scientists. Secondly, the pandemic has claimed a lot of lives. Many people have perished. And I think if we're to check each and every church, how many people they're burying, we could find the statistics there. But the issue is not so much about that. Is that all of us must pool our resources, our energies, our efforts in trying to comply, because the intention of the regulation is really to save lives. Because unless we have lives, there will be no church. Unless people live, we have no country, and therefore we shall have inherited rubbles or structures without people. So the effort of each and every one of us across the board, cultural, religious, and linguistic communities, is to make sure that we preserve life and we respect the sanctity of human life. Of course, even our Constitution places the primacy of life at the highest level, because it's very important to be alive today.
I'm wondering if you feel included then in the national response to the pandemic, especially by government. Another conversation that I've been hearing in the last few days was with the Limpopo's Health MEC, who was saying because it's a largely rural province where they still have chiefs in some of the communities, that's where she's gone to try and get the message out as far as issues around gatherings and vaccinations, for example.
It is important. The message must go on each and every corner of our country, loud and clear. Delta virus pandemic is dangerous. It spares no one, whether rich or poor, pastor, Christian, cultural, religious. It spares no one. You have listened to the voices of the young people who are saying it is horrible. Some, even one of them said, "I lost my loved ones." Imagine that cry. It's a season that we must all respect. Pool our resources, our energies as a country. It is not important we should bury our differences and focus at what we must do together to save our country, to save our nation. And hence this call. At the center of it is really an appeal to each and everyone to understand that we're at a crisis moment And this crisis moment requires a different way of behaving. And two wrongs do not make a right. If you have a complaint, deal with a complaint, but don't make a complaint supersedes the importance of the sanctity of human life.
So beyond the Sunday services or services held at mosques and the like, a lot of religious leaders have said, well, we need to keep churches open because people rely on their pastors, their spiritual leaders for counsel during what has been a very traumatic time. People have come very close to death and survived. Some have indeed, as you rightfully point out, lost loved ones. There is now, as a result, conversations going on about vaccinating or prioritizing the vaccination of religious leaders. Would you endorse that call? Would you support it?
It is important that they be vaccinated. They play a very important role. The issue of access to our members, they can do that through Zoom, through WhatsApps, through voice recordings. Many leaders do that because it's a way in which we have to make sure we service our congregants at this time. For example, I had somebody who was sick in my house. I received a call, and the priest prayed to the sick person through the telephone. And it does happen. And the person is now much better, but there was no contact at all. So we need to use new ways, modern ways, because the virus, in fact, is eliciting that we actually adopt new strategies of doing our business or accessing our congregants wherever they are.
Let's leave it there, sir. That was Chairperson of the Commission for the Promotion and Protection of Rights of Cultural, Religious and Linguistic Communities, or commonly referred to as the CRL Commission, Professor David Mosoma. Thank you for your time.